we are having a very, very special webinar from Manipal College of Pharmaceutical Sciences, which you are aware is one of the premier institutions in India for professional courses in pharmacy. Way back in 1963, they started their D Pharm. 1965 was their B Pharm, and eventually M Pharm 1970, 2008, it was the Pharm D. So the entire repertoire of courses are available there, and what a legacy. Yes, they also have international collaborations. Just look at the kind of collaborations they have. The students can work along with the inputs from Griffith University, which is in Australia, Harvard Medical School, Institute of Chemistry at Ceylon, that is Sri Lanka, and also the University of Queensland in Australia. Amazing, isn't it? Well, the COVID-19 has been a disruptor which is unparalleled. So this viral infection, which is basically caused by a 60 nanometer particle, if you can call it a living thing, it's basically a protein shell with the positive sense RNA. So which means it's that polarity. And it's also called the SARS-CoV-2. That's the name of the virus which is causing the COVID-19. And this SARS-CoV-2, once you inhale it, or it gets into your eyes, or it gets into your mouth, oral cavity, there are ACE2 receptors on the outer surface of the cells. So this is in the respiratory epithelium, nasal mucosa, oral cavity, and lungs. And this goes and latches onto that ACE2 receptor because of the spike protein, which has two subunits. One helps in the attachment, and the second is required for the entry. So basically, this virus will assimilate into the cell surface itself, the cell membrane, and gets into it. So what it does, the RNA gets in, controls the cellular machinery, makes copies of itself, and then starts transmitting the new viruses to other cells to go and invade. So this is how the invasion of this entire COVID-19 SARS-CoV-2 happens, and that causes all the problems. So basically, any cell which has the ACE2 receptor is a typical host cell for the COVID-19 virus SARS-CoV-2. And what are all the symptoms? Well, you can have fever, there is also cough, the major URTI. But the problem is when it gets into the LRTI and results in breathlessness, that means there is damage happening to the lungs, and that's when it becomes very severe, very tough for the patient to recover. This COVID-19 has its economic impact. The Indian economy has contracted, forget about growth, 7.3% in April, May, June this year. Further, the 2.9 trillion economy, which we are having, 2.9 trillion US dollar economy, is stagnant. Tourism and the various hospitality sectors, which all depend on movement of people, are totally affected. But what's happening to the pharma industry? That's the silver lining. Roche has got 367,487.99 crore sales. Remember this interesting figure because I'll put it in one perspective. If you take the Johnson & Johnson company, including its consumer group business, the sales value is 6,08,850 crores. One company having that much sales. And if you look at the Indian pharma industry, all companies put together, the sales value is 1,61,097 crores. That's all. So the largest company, Johnson & Johnson, which has 6 lakh crores, and the entire Indian pharma market value is 1,61,000 crores. So you can imagine the muscle power, the money power of the multinational companies, and you can imagine what an affordable rate at which India is making its medicines. So this is the interesting facet. And due to the COVID-19, a drug called Favipiravir, the brand name being Fabiplu, it has gone up to 352 crores per month sale in April, and total per annum sale is 950 crores. Today, that is the number one brand, but obviously things will keep shifting. When COVID-19 comes down, other types of drugs will go up. Fabiflu, in fact, overtook even Zincovit and Dolo tablets to go and reach the top. We all know that it is important to smile, because when we smile, neuropeptides which are required for fighting stress get released, including dopamine, endorphins, serotonin. So you start feeling very good. And when you look at children, we like them because they smile 400 times a day. Happy people smile 40 times a day. And the average person smiles only 20 times a day. And the importance of smiling, like for example, when you saw the presenters, including Dr. Kaushik and the other two gentlemen, the first thing that you noticed in them was their beaming smile, because 47% of the thing that people notice is the smile. So, Group Pharmaceuticals dedicated to creating healthy smiles through a repertory smorgasbord of interesting products, including for post-dental filling. As you can see, I'm flashing the pictures of the various toothpastes. Now, before we go on to the thing, I'm looking at the chat box. You can start typing the answer. Okay, name the non-monoclonal antibody drug. Non-monoclonal antibody drug used in treating rheumatoid arthritis and malaria, which was initially used for prophylactic treatment of COVID-19. Can you mention the name? Name of the drug. Yes, there are prizes available. Gift hampers will be dispatched after you give us your address. Please type the answer in the chat box. Name the non-MAB drug used in treating rheumatoid arthritis and malaria, which was initially used as prophylactic treatment for COVID-19. Name the drug, quick. I'm not seeing any answer being typed in the chat box. I want the answers rushing in. Please, yes, Venkatesh has hit the nail on the head. Okay, Venkatesh, you got the first one correct. It is hydroxychloroquine. Yes, HCQ. Gokul, you're slightly late. Venkatesh was first. Let's go to the second question. Again, a very sitter question. In ACE2 receptor, give the expansion of ACE. Can anybody give me the correct expansion of ACE? ACE. Please write down the expansion of ACE. Let us see whether you know about it. Venkatesh has already reserved one prize. Let us see who else will get the prize. Give the expansion of ACE. ACE. Anybody? I'm not seeing the answers coming in. They should start coming in fast and thick, so that I'll find it very difficult. Fastest finger first. The person who gives the first answer will get the prize. Yes, angiotensin converting enzyme. Sanskriti, you got it correct. So you are one of the winners. Congratulations. So Sanskriti has hit the nail on the head. Gokul is answering well, but unfortunately it's not on time. The next question will come in. Let us see. Name the most popular plant that is useful as a immune support to help prevent and manage COVID-19. Only one plant, most of the people agree, is useful as an immune supportive for COVID-19. Which is that? It is a very, very popular plant. You would have studied it in pharmacognosy also. I will not give more details about it. Sushmita, you are a little late. Now answer this question. The answer should come very fast. It also depends on your network. Otherwise, it will not come in fast. Tulsi, Prasad, Neem, Venkatesh. Well, only one plant has been proven. I am not looking for that answer here. I'm not getting that. It's not Tulsi. It's not Neem. Let me come across. Not Neem, Sauradeep. Let us see who is going to give the right answer. Don't make me give the right answer. It is something which you have studied in your pharmacognosy, or you will be studying it. It is a very interesting plant. Everybody knows about it. Let me wait for a little few more seconds before I move to the next question. I'll give the answer, but I would like to know. Ginger, no, Prasad, you are missing it. It is more, what do you say, technical than that. In the sense, it's not these sort of common plants. Only one is proven. Only one is proven to help as an immune support. Which is that? I will not accept ginger, neem, or any other drug. Which is that? I'm giving one hint. It starts with A, not Giloy. It starts with A, not ginseng. It starts with A. Ginseng is somewhere near. It starts with A. Okay, I'll give you the next letter. A-S. A-S. Anybody who would like to guess the answer? I know all of you know it. It is ashwagandha. Yes, Sairaj, you got it right. This is the only drug in the herbal platform which has been proven to provide the immune support. We'll go to the next one. Name the company which has manufactured the world's first plasmid DNA vaccine. Please understand the question. The company which has manufactured the world's first plasmid DNA vaccine. I would like to know the world's first plasmid DNA vaccine was manufactured by one company. AstraZeneca? Question mark. I don't want to really say right now. Let us go on getting the answers. The world's first plasmid DNA vaccine. World's first plasmid DNA vaccine. If you have been keeping abreast with the various goings on in the newspaper, Nikita is correct. Yes, Nikita, it is Zydus Cadila which has got the very first, the COVID-19 plasmid vaccine was manufactured by the company Zydus Cadila. Many of you have got it correct, but I have already given the prize to Nikita, who was the first. Now, last question. Let us see who will get the answer. Okay. Is the COVID-19 virus, that is the SARS-CoV-2, carried by the mosquitoes like Zika virus? You have to answer with just a yes or no. Is it carried by the mosquitoes like how Zika virus is carried by the mosquito? Is this SARS-CoV-2 carried by the mosquito? You have to just say yes or no. Okay, the first answer who gave us no, I am finding it difficult.
Manoj.
Oh, Manoj, our own Manoj has got it. Okay, Manoj has taken the prize. Congratulations. So the winners have to send me your name, address, and mobile number to this email ID, sunilchiplunkar@gmail.com or sunilchiplunkar@grouppharma.in. I will also type it in the chat box. So that is how, so the numbers are stabilizing. We hope more number will join in as we proceed. You can ask your colleagues, your favorite professor is going to give a nice talk. The first speaker today is Dr. Madhavan Nampoothiri, sir. Assistant Professor, Selection Grade, Department Pharmacology, MCOPS, PhD from MCOPS, Pharm from the Government Medical College, Trivandrum. One of his interesting points is that he has got a number of conference presentations. That is, most of them are oriented towards, of course, the preclinical studies, focusing on the cardiometabolic disorder space and brain function. He has been to Kyoto, Japan, Singapore, Perth, Bangkok, Thailand, KL, that is Kuala Lumpur, Malaysia, Dubai, UAE. Awesome. What a very nice set of achievements. The research grants which he has got are from CSIR, Department of Biotechnology, from Griffith University, and also travel grants to Netherlands and Japan. He has been awarded a number of these fellowships and scholarships as an investigator from developing country, instituted by Melvin International for the Parkinson's disease, Nagai Shukri Award from the Asian Federation for Pharmaceutical Sciences. He is also the member of the Board of Studies at the Kerala University of Health Sciences. He has a number of publications to his credit, which include on interesting topics like autophagy, COVID-19, and hydroxychloroquine, caffeine, dementia, brain function, behavior, inflammation, cardiometabolic disorders. Very interesting array of products. Love in Tokyo. This is his photograph from Kyoto. Sorry, not Tokyo, Love in Kyoto. So that movie was Love in Tokyo, which was a very, very famous movie. So awesome, sir. It is very nice to have you here. Congratulations on all your achievements, Dr. Madhavan, sir.
Thank you, sir.
So
I
will flash your presentation, and the floor is yours. Thank you very much.
So, warm welcome to all of you to the presentation, that is involvement of the nervous system in COVID-19. Thank you, Sunil sir, for your nice words and overview. So, when we discuss regarding the COVID-19, initially the COVID-19, or when the journey of the virus is looked at, initially it started as a journey of a virus causing respiratory illness, which began in December 2019, has brought us now into the middle of a pandemic, which claims around millions of lives of the people. So, in the initial stages of the COVID-19 infection, the organism, the virus, termed as severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, has got a paramount effect on the respiratory system. And the respiratory system, which is affected by the SARS-CoV-2, result in several symptoms that ranges from breathlessness, pneumonia, as well as acute respiratory distress syndrome, which is characterized by pulmonary edema, hypoxemia, as well as reduction in the size of the aerated lungs, which is termed as acute respiratory distress syndrome. However, looking at all these facts, it's lesser known are it's the effects of SARS-CoV-2 on the CNS, which is now slowly seen in the worldwide population. The interesting fact is that when we look into the distribution of ACE2 or angiotensin converting enzyme 2 receptors, these receptors are widely distributed or present in several regions of the brain. So this makes it an interesting point to see that there might be chances that the SARS-CoV-2 virions might have managed to infiltrate or to evade into the brain. So now let's see what are the evidences that are available for the entry of SARS-CoV-2 into the CNS. So how can this SARS-CoV-2, what are the ways through which the SARS-CoV-2 virus can enter into the CNS? So we'll see one by one the routes through which the SARS-CoV-2 might have managed its path to enter into the CNS. One of the important way is the cerebrospinal fluid. So when we look into the cerebrospinal fluid is produced by the choroid plexus that are present in the ventricles of the brain, and from which through the lateral and medial aperture it flows into the arachnoid space of the spinal cord. So the brain and the spinal cord is the essential parts of the CNS or the central nervous system. And the cerebrospinal fluid is one of the important fact which connects the peripheral nervous system with the central nervous system. So the CSF is one of the diagnostic marker to check any disorders that are associated with the CNS. So when a patient came to the hospital with the problem of encephalitis, so the patient was checked for, or the CSF was taken, and the CSF was checked for the presence, or the CSF was subjected for RT-PCR, and the CSF was found to have the presence of SARS-CoV-2. RT-PCR was positive, and the patient was having the presence of SARS-CoV-2 in the cerebrospinal fluid. That was one of the cases. And the next case was another patient with a neurological symptom of demyelinating disease. So the aspects are that these are not the common symptoms of SARS-CoV-2, as earlier we had seen the ARDS and respiratory illness. Whereas when another patient with a neurological symptom of demyelinating disease, when the CSF was subjected to the RT-PCR, this patient also showed the presence of SARS-CoV-2 in the CSF. Apart from that, there were several cases which was reported henceforth, which showed the presence of SARS-CoV-2 in the CSF, including the patients who had shown mild symptoms such as headache as well as impaired consciousness. Once the SARS-CoV-2 virus enters into the cerebrospinal fluid, it generates SARS-CoV-2 antibodies. In the sense, in the CSF, the immune system tries to attack the SARS-CoV-2, as a result of which the antibody starts producing in the CSF. So in several cases of COVID-19 encephalopathy cases, the presence of SARS-CoV-2 antibodies were identified in the cerebrospinal fluid. However, when a large study was conducted and the cerebrospinal fluid was taken for the examination of the presence of SARS-CoV-2, it was not coming to have effect in all the population, and a general consensus was made that only in cases of people who shows the neurological symptoms, the CSF has to be taken. One of the important aspects is the technical difficulty in taking the CSF, that is the lumbar puncture, has to be done. And the technical problems that are associated with the taking of the sample of cerebrospinal fluid as a diagnostic marker. And the another problem is that having set the incubation period of SARS-CoV-2 virus to be the first 5 days, there might be chances that the viral load that is present in the CSF to be too low by the time the neurological symptoms appear, because the neurological symptoms appear after some days. And by the time the SARS-CoV-2, the viral load that is present in the CSF might be lesser. That might be the reason that even though the patient has shown the symptoms of several neurological disorders, they could not identify the SARS-CoV-2 virus in the cerebrospinal fluid. Another interesting route is, the second one is olfactory route. One of the striking features of COVID-19 is anosmia and hyposmia. Anosmia is the lack of ability to smell, and hyposmia is the diminished ability to smell. The importance of olfactory route is that when you look into the olfactory system contains the olfactory sensory neurons, as you can see in the diagram. The olfactory sensory neurons, and this olfactory sensory neurons has got a connection to the olfactory bulb directly through a small gap, which is called the cribriform plate. So unlike the other special senses like tongue or eye or ear, which goes through the medulla oblongata and then comes back to the cortex region, here the olfactory system or the olfactory pathway is directly linked, or it is directly linked to the olfactory bulb region, in the sense it offers a path for the entry into the CNS without crossing the blood-brain barrier. So a higher amount of SARS-CoV-2 was identified near these regions of olfactory mucosa. olfactory bulb, and also in trigeminal ganglion as well as in medulla oblongata. And also in several patients, the MRI evaluation has showed bilateral olfactory bulb edema. So this all points out into a fact that olfactory route is an important route which paves the way for the SARS-CoV-2 to enter into the CNS. Coming to the third route, that is called trigeminal nerve. So trigeminal nerve is one of the interesting pathways which has got three divisions, that is maxillary nerve, ophthalmic nerve, and the mandibular nerve, through which joins together in trigeminal ganglion. And the SARS-CoV-2 gain entry through these nerves and enters into the trigeminal ganglion. The importance of this pathway is that there are several cases where there occurs a sudden respiratory failure, even though the patient does not show any initial symptoms, but it will result in large amount of problems which are connected with the respiration quickly and will result in a sudden respiratory failure. So one of the hypotheses is that the trigeminal nerve connection with the nucleus tractus solitarius, or the NTS, which is responsible for the neural regulation of respiration, which is associated with the respiratory nuclei. So when this respiratory nuclei is affected by the entry of SARS-CoV-2 virus through the trigeminal nerve, that results in several problems such as clotting, microvascular clotting, pulmonary edema, and also the cytokine storm that result in severe respiratory depression, which is not associated with in the lungs or the peripheral system, but from through the trigeminal nerve nucleus tractus solitarius connection with the respiratory nuclei. The fourth route through which the SARS-CoV-2 can enter is the hematogenous route. So when there is a large amount of SARS-CoV-2 in the peripheral system or the peripheral system, and if there is an insufficient peripheral immune clearance, that means the SARS-CoV-2 is not able to get cleared by the peripheral system, that causes a continuous increase in the viral load in the blood. So when this viral load increases in the blood, this causes a destruction of the blood-brain barrier. And not only the blood-brain barrier, the blood-CSF barrier. There is a mechanism called Trojan horse mechanism. So Trojan horse mechanism is the mechanism by which the viruses enter. Trojan horse, we have to go back into the Greek mythology, which describes Trojan horse is a wooden horse which was a hollow horse inside, where the soldiers were concealed and the soldiers enter into the city of Troy in Greek mythology. That is called the Trojan horse. So similarly, SARS-CoV-2 virus also uses the macrophages. It enters into the macrophages, and macrophages serves as a Trojan horse to get the entry of this virus into the CNS by damaging the blood-brain barrier as well as directly affecting the neurons as well as the glial cells. So this is one of the route that is called the hematogenous route. The two other routes which are having effect on the CNS is the neuronal dissemination and the gastrointestinal route. As you can see, the neurons has got a paramount importance because of the fact that the neurons can receive as well as the neurons can transfer the data. So because of the axonal transport system, the axonal transport system will allow from the periphery through the peripheral neurons to gain access into the CNS. So this mechanism by which it flows into the CNS is called the neuronal dissemination. And gastrointestinal route is another route which has got connection with the enteric neuronal network. And this enteric neuronal network has got connection into the CNS, that is called the enteric nervous system or the enteric nervous route, which is connected to the CNS. So these are the routes through which the SARS-CoV-2 virus can gain entry into the CNS. One that we discussed was regarding the cerebrospinal fluid. Second one is the olfactory route. Third one is the trigeminal route. Fourth one is the hematogenous route. And fifth one is neuronal dissemination. And sixth one is gastrointestinal route. So these are the proven evidences through which the viruses enter into the CNS. Now let's see, what does the neurological disorders are the one that is associated with the SARS-CoV-2. So when you look into the neurological disorder, one of the neurological disorder is seizures. So in the initial stages of COVID-19, one of the important study was conducted by Liu and colleagues. This study was conducted in Hubei province in China, which was the epicenter of COVID-19 at that point of time. So they assessed around 304 COVID-19 patients. And these patients did not have any history of seizures. However, seizure was observed in 27% of this population. That is around 84 cases. But when you look into the seizure manifestation, as the SARS-CoV-2 is connected with the respiratory illness and the lung disorder, one of the important risk factor for seizure might be hypoxia. So they concluded that hypoxia may be one of the common risk factor for seizure in COVID-19 patient. This was one of the first study which was conducted in China. However, later on, two important studies, that is, one is by Fusano et al., one case by Fusano et al., and another one by Volono and colleagues. These two were the cases of, one was a case of focal motor seizure, and another one was a case of focal status epilepticus. These two were the presenting symptoms. Interestingly, the body temperature was normal and the patient did not show any pulmonary involvement. So the patient came to the hospital with the seizure and the patient was diagnosed. Patient did not have any previous history of seizure. The patient was diagnosed as focal motor seizure, and when the RT-PCR test was done, the patient was found to be COVID-19 positive, COVID-19 affected later on. So these studies suggest that the seizure might be an initial symptom which is associated with the SARS-CoV-2. So seizure is one of the important neurological disorder that is connected with COVID-19 as a manifestation. Next one is the Guillain-Barré syndrome. So Guillain-Barré syndrome is a disorder which is occurring due to the demyelination that occurs in the axons, which result in the less functioning of the tendons, and finally it result in the even in the paralysis of the facial muscles as well as the limbs. So the GBS is one of the important neurological disorder. You can see several cases has been reported with COVID-19 resulting in the Guillain-Barré syndrome, which is connected with the COVID-19. So in the table, you can see the number of cases which were, even though the RT-PCR was negative in several cases, but the patient was detected to have GBS with COVID-19. So the GBS is one of the important neurological disorder that has resulted in several negative consequences in the patients, in the COVID-19 patients. Another disorder is viral encephalitis. Viral encephalitis is the inflammation of the brain, and inflammation of the brain will result in the impaired consciousness and may result in seizures, fever, respiratory malfunction, GI symptoms, etc. So when the virus or the SARS-CoV-2 virus gain entry into the CNS, it may cause the inflammation in the brain because of the fact that this has got an effect on the glial cells, especially the neuroglia, microglial system, which result microglia is considered to be one of the important factors which governs the immunity of the brain. And thus the microglial system, which result in a cytokine storm, microglia releases the cytokines in the brain, which result in neuroinflammation, and subsequently it result in the encephalitis. So viral encephalitis and the mechanisms through which the SARS-CoV-2 produce these encephalitis is through the neuroinflammatory mechanisms, which is through the microglial cells. Then coming into the meningoencephalitis. So this here, there is an inflammation that happens in the meninges and the brain. So one of the interesting cases was in the CSF of a COVID-19 patient with meningoencephalitis. The SARS-CoV-2 virus was detected in the CSF. One of the important aspects regarding the CSF is that the host immune defense system in the CSF is not that strong as compared with the other immune system that is prevailing in the body. As a result of which, the pathogens multiply rapidly, and the inflammatory mechanism responses that occurs and the paucity in assaulting the virus also will result in such inflammation of the meninges and the brain, which is attributed to the meningoencephalitis. The last disorder that which I wanted to point out is regarding the acute cerebrovascular disease, or ACVD. So acute cerebrovascular disorder cause problems in the cerebral blood vessels, and the flow of the cerebral blood is affected, and as a result of which the oxygen supply to several cerebral regions will be decreased. And the main indications connected with this ACVD are the stroke, ischemic stroke, which is caused due to the blockage of the cerebral blood flow and the reduced oxygen supply. So there are several reports which have shown high levels of D dimer levels that is present in the COVID-19 patients, which connects or which interlinks the greater incidence of the ischemic stroke and the presence of the acute cerebrovascular disease in several patients. So these are some of the neurological disorders which points out towards the effect of the SARS-CoV-2 virus in the CNS that are ranging from seizures, Guillain-Barré syndrome, acute cerebrovascular disease, meningitis, meningoencephalitis, as well as the encephalitis. So, to conclude the presentation, the SARS-CoV-2 virus gains entry into the CNS through several routes such as cerebrospinal fluid, hematogenous route, olfactory route, neuronal dissemination, as well as the trigeminal nerve. And the neurological manifestations which are surfacing as a part of the CNS effect by the SARS-CoV-2 viruses are seizure, Guillain-Barré syndrome, meningoencephalitis, respiratory failure, acute cerebrovascular disease, and viral encephalitis. So, regarding this presentation, we have published a paper. I acknowledge with thanks to my student Sairaj, PhD student Sairaj also. We have published a paper, Involvement of the Nervous System in COVID-19, the bell should toll in the brain, in the journal Life Sciences in the year 2020. And the point of discussion regarding this presentation was made up from this particular paper. So this is regarding the importance of looking at the nervous system as a point of several neurological manifestations that can seen in COVID-19. So I'm stopping at this point of time, as the time given to me is 20 to 30 minutes. So thank you to
Thank you very much, sir. It was
any
awesome.
question. If any question, shall I take it now or later?
No, we'll take it later, sir,
Later.
because it will get late for
Yes,
Dr.
yes,
Nayak,
yes,
sir.
yes.
So it was awesome. Let me give you a standing ovation, because the last but one slide was fantastic, sir.
Thank you, sir.
Particularly where you summarized the entire roots as well as the manifestations.
Thank you.
So now let's go on to the next speaker. A very warm welcome to Dr. Nayak, sir. And in this series of a special webinar on Manipal MCOPS, where, Dr. Nayak, sir, has a fantastic profile. After completing his B.Pharm at MCOPS, he did his M.Pharm from GCP Bangalore. Well, at least I have something in common with him. And PhD at MCOPS. He is a teacher, researcher, as well as he has worked in different fields of pharmacology. Today, pharmacology itself has got splintered into so many subunits. And Dr. Nayak, sir, has authored or co-authored 55 research papers, contributed 5 chapters in books. And as a researcher and teacher, he has also provided several inputs to his institution. He has organized the AICTE Faculty Development Program on Conduct of Research and Publication Ethics. Apart from pharmacology, Dr. Nayak is well versed in research database analysis. Now, that is something very interesting, because he is a regular consultant for bibliometric and scientometric related data for Directorate of Research, MAHE Research. He has in fact developed his own course. Now, that is the beauty of Manipal, where if you have the expertise, you can develop your own courses. He has developed a certificate course on research orientation for beginners. So that is something fantastic, actually. And currently, he is running a center. The name of that center is very interesting, Center for Research on Research. And this is under the Directorate of Research of MAHE Manipal, and is assisting in comparing the publication data for university ranking. His current area of research is in cutting-edge areas like in silico drug discovery, which is what is being talked about, preclinical pharmacology, network and systems pharmacology. Amazing. So this is one of his action movie pictures where he is delivering one of his important talks. So that was Dr. Nayak in brief. Congratulations, Dr. Nayak, sir, Yogendra Nayak, sir. You have done something awesome, and I really liked the center which you are heading for doing research on research. Over to you. The floor is yours. I think you can share your PPT and go ahead.
Thank you, sir. Thank you for the nice introduction. I'll just share my slides and give me feedback how it looks like.
Sure.
Is it visible here?
Yes. You go to the slideshow.
Yes.
Okay, Paka, you're on.
Yeah. So thank you for the nice introduction. What I do in the Center for Research on Research is research analytics, research output analytics, plus along with that comparing different universities for research aspect. Of course, there is not just me involved in analyzing all the data, but there are many people are involved. That's one of the area where I studied. I took interest in analyzing research output starting from my joining at Manipal, and then started thinking about it. There were very few specialists on talking about bibliometrics and scientometrics. So I took the opportunity, and people recognized me at Manipal, and they gave a center which is research on research. It was established in 2017. We were doing it, and a part of that I'll also be presenting here in this forum. So today I'll be talking on, because of this center, I got to expose towards many different aspects of different universities, what they do we have that facility, or do we do that in India? These are the kind of questions that came across, and this is one of the important area where I found interesting, and we can do some small research in that area, or we can practice if you're a community pharmacist, because that is not been explored in community pharmacist. But in fact, in reality, if you see here, two things, what you can see here is mainly, I'll just, yeah. So one part is COVID paradigm changes in the COVID-19 era, and along with that, e-professionalism. So what is, or e-professional means, I mean here is e-professionalism. So e-professionalism is something different than the professionalism. So let me begin with my talk with some introduction for the professionalism and then e-professionalism. These are my content of today's talk. I'll give introduction for professionalism and e-professionalism. I'll also give a brief on COVID-19 change management and communication, digitalization and e-professionalism, e-professionalism values to be upheld or values to uphold, or opportunities for the community pharmacy. These are the topics I'll be discussing about in this talk. Now, all of us know, we are all say we are professionals, and that is the definition everybody knows. But then, in fact, it is not like that. If you say electrician, we can't say professional. But if they do professionally, we can say that professionalism. So this is a definition given by one Australian professor. This is a recent professor, a definition given by, as per the references, which I understood from the literature search. So you can see here the specialist, how they treat the patient, or electrical engineer, or a computer sciences, or a computer hardware engineer is a specialist. He does all that. A marketing specialist. Similarly, there are different professionals which we can say they are professional in their life. But then there is limitation for this professionalism. You can't say everyone. Say auto drivers, you can say their job is driving auto and serving the society, but you can't trust all the auto drivers equally. Or a plumber, it's very difficult to get a plumber than getting a vice chancellor. So you can meet a vice chancellor easily, but it's difficult to get a plumber to repair water leakage in your house. These are the scenario that is happening. So that's the reason we don't say a plumber a professional, but he does a professional work. So what is this professionalism is mastering a specialist. So I have mastered my pharmacology as my subject. So I am a specialist. I am a professional in that. But I practice teaching. So then my teaching is my profession. So that is how we say professionalism. Then validated, reliable knowledge base. Then only we can say that it is a professionalism. Now this validation, who does the validation? We acquire our degree by studying something. We ourselves, we serve the society, get the certificate, and that is how we become a professional. We get the practical skill and competency. We are very, very competent for each and every aspect. So then we can say then it is a professionalism. Of course, if a plumber is not coming when we call, or is not answering, we don't say it is he's not following the morals, or he's not following ethics. So, but a professionalism, there is definitely ethics. There are a set of guidelines you have to do like this, do like this. Whereas a plumber or auto driver doesn't have any guideline. They have certain rule of society, but not as a profession. So then we can't call them as a professional, but they do a special job and they're essential part of a society. But then the ethics matters. So that is one important component of all the professionalism. And along with that, we need to have image, or what is called as self-regulation. So that is very, very important, and that is most of the time it's lacking. As a teacher, as a researcher, I have done a lot of things, but the developing image is a difficult task. So that has to be developed, and then it is a successful professional, you will. Then what is this e-professional is? Because we metamorphosized from the olden days professionalism to the modern days internet-based professionalism that we call is e-professionalism. Nothing but engaging ourselves in online platform. So that is nothing but digital presence. So we have to have our digital presence, and that is very significant during the COVID-19. And because everywhere it is locked down, and we are showcasing only through the digital platform. So there was just prior to the COVID-19, we call it the pre-COVID era, and just after the COVID incidents, a post-COVID era. So there is a lot of difference that we discuss in the coming slides. But engaging oneself into online digital platform is a greatness, and that is not exactly in the definition of professionalism, because it's olden days definition. So engaging ourselves in a online mode is e-professionalism, but we should not post anything and everything that is coming. So we should also have attitudes and behaviors. So a lot of guidelines that are coming on in different universities and different profession, that what are the attitudes and what are the behavior, what are the guidelines to be followed in e-professionalism. So it is it is all related. Attitude is always related to the behaviors. So we are not defining here what it is and all, because it's a vast area of understanding. It's a philosophy behind it. Truly speaking, this e-professionalism, I have not made anything special achievement in this area, but we have seen such changes across the globe, and that is I am presenting here. And we have seen some changes. We have made some implementation also in Manipal. Let me explain that here. Now, what is this? The different platforms we have here. We had few platforms, something like Facebook. Everyone uses this. Twitter, all that comes, hundreds of platforms we get, but we can practice. It's not necessarily one platform or two platform. It's difficult to have more than 4 platforms. So it is ideally Facebook, Twitter, or what we say is LinkedIn, or some Google. That's mostly people does, but we also engage in such kind of but not many. But if you see currently, most of the people are engaged in Facebook, Twitter, and Google. So there are many platforms. Similarly, Indian rivalry came. We have to have our own platform in India, and we have to. So in place of Twitter, we also got Kahoot or something. A lot of different apps have come up, and people are using that. So this made a paradigm shift in the profession. So engaging ourselves online, because everyone are busy in online platform or social media platform. So unless and until you engage yourself into a social media platform, it is difficult in the future generation to survive. So it is difficult to convince the younger generation, because those are all on social media. So you have to attract, you have to do the business, you have to have a platform on the internet based, or in the website. You should have a place where you can share your things, you can do your profession along with the professional services. So it is not necessary that you have to do only online profession. You can have your, as a teacher, I can be teacher, but at the same time I can also serve the people by creating the website. It is that platform I'm designing, I'm explaining here what we can do for the society. Let us see the pre-COVID scenario, what has happened to the mobile phones. It was a big threat everywhere. Mobile, this symbol is slowly disappearing now because of COVID pandemic. So we sat more than 1 month to make the guideline. So at the department level, before COVID, we decided not to allow mobile to the school, to the college, to the professional college like Manipal College of Pharmaceutical Sciences here at Manipal. Also, this symbol also metamorphosized. It was an old phone, then it has changed to a newer one with the touch screen. So all that is technology oriented, and we have to adapt ourselves for the technology. So, but then there were a lot of changes and guidelines are made to how to get rid of this mobile, or called as mobile minutes. There were guidelines, certain guideline of around 5 pages. It was brought out, but then immediately COVID lockdown came, and without mobile we could not survive. So that is the scenario. Immediately COVID-19 changed all that guidelines. We have to keep it below the table, or we have to hide that guidelines so that people can start their work online using mobile. So you can see here a teacher is explaining everything using the mobile. There's no go, because mobile is the only communication to the students here. So the students are, students is small school children also allowed now mobile. So because there is no other way to survive, no other way to communicate, there is no other way to educate the people. So only mobile is a method, because mobile everyone keeps, and it's a cheap one compared to the computer or laptop. So people go by mobile communication, with online classes, everything. Once upon a time, we used to say children should not use mobile, but everything changed just by 1 or 2 months. Everything changed. All lifestyle changes. That's a paradigm change that has happened. Now it is not stopped here, because a lot of guidelines also came. NEP, National Education Policy. It was happening from 2016, 17, 18, and then almost implemented in 2019. But then the COVID-19 started in 2020. It has to pass in the Parliament, but it released in 2020 with the mask on the face. So everybody wearing mask. We released NEP in 2020. A lot of modification. It's a breakthrough. The philosophy of this education system, national education policy, is a great. It's very, very ambitious, and it is going to make a change in Indian education system and future of India. It's going to change. And this has happened in other countries like China or Japan long back. Now we have just kept quiet without changing the earlier policy. So now the changes has come. It doesn't mean that earlier policy was bad. We had 10+2 education system. It changed to 5+3+3+4, and it is a wonderful philosophy of education. But there are some hurdles. Definitely there is no hurdles in the professional education what we have currently, higher education, and that will remain amazing. But to say a few of the example is advanced tools for teaching and learning. Now, whatever the outdated chalkboard, board and chalk talking to the class is all outdated. It is going to change. What we are doing today, webinar, is a fantastic learning mode, and that is going to happen in the future. Most of the courses will be delivered online. So advanced training to the teacher is essential. So for example, when suddenly the change over to the classroom teaching to the online teaching, teachers got scared. Mind you, there's our former vice chancellor. He was a great educationist or education researcher, Ram Narayan, Professor Ram Narayan. He wrote that it is a phobia that is created to the teachers. It's called a covido-pedagophobia. So that's a type of change that has happened. But everyone adjusted very fast. Everyone learned everything, because all teachers has a skill of learning. So advanced learning is a very important task of NEP, and that's all happening. And most of the courses will have self-directed learning or lifelong learning. So that is the philosophy. It's going to change all that has happened in the post-COVID era or during the post-COVID era. Now, in fact, this made a change. There is a lot of information changes that messages, false messages that are passed on because of COVID incidences. So to control this, government has to implement IT rules. So information technology rule 2021 is also implemented. As per that, this was not there earlier. Each platform should have a grievance redressal officer, and many of the company objected this, including Facebook, Twitter, Google. All people objected, but of course they have to agree and come back, and all of them are appointing. They were given 90-day, time to officially engage some grievance redressal officer, and they're doing. What is happening is they can trace any message that is uploaded online. So this is helping for our e-professionalism also. So anything that is put in the website is caught. Anything can be traced, which place it is uploaded and how they upload. Everything can be captured by the platform. They have the abilities, but they are not doing. So for that reason, the grievance redressal officer makes it a change in the future digital era. So it looks like we are prepared for the change, of course, but the change management is a very important task. Changes happen in business technology, business terminology. When you use change management, and effective communication of the change is important, and that is the task. If they do that, 80% of the job is successful. So the change in the era, that is COVID changes, if it is effectively communicated to the society or to our stakeholders, so the 80% of our job is done. So that is what it is. But here a lot of uncertainty was there. This change is not something which is regularly happening in the administrative level or in the organization level. This change is a societal change. It has happened on each corner of our society. Maybe we can think of a molecular level research, we can make it, but at the end, it is the societal vaccine goes to the society, not to the individual person. Though it goes to the society, ultimately it goes to the patient or the person, and he takes the vaccine, he will be surviving. So, but then a lot of implementation processes involved there. So to say that these kind of changes, they also, I think Sunil sir will be knowing much better about this. We say that it is VUCA, volatility, uncertainty, complexity, ambiguity. This is a very difficult to tackle in case of business. So when the market is having high volatility or uncertainty, or there is a complexity in understanding the market, or there is a lot of ambiguity in the market, this terminology is existing. Now, this terminology is very well holds good in the research also, in the academics also, and that is true. But to say who has first coined this term in the book, these are the scientists, social scientists, who have labeled VUCA, and it has become everywhere VUCA now, and we tell everything say VUCA, because it's all volatility, because we don't know, the information comes and then disappears about COVID, and a lot of uncertainty about COVID, very complex to understand, and a lot of ambiguity against the COVID vaccine. All that is there. To tackle that, we should be, a leader should be a very, very strong communicator. So we have a leader here, and a great leader. And he initially planned long back in 2015 that initiation of digital India was there, and we all digitalized at that time. Thankful to the great man, of course, compared to the other people who also said, poverty is just a state of mind. I don't know the meaning exactly. I was just understanding that he was called for a presentation in a university in UK, and where he mentioned this poverty is just a state of mind, and it continued. But I'm just telling you, the way it was, and a lot of controversial things that have happened. But compared to them, our leader is great. And there are many leaders who think about India or dream about India, or they only dream. But then a reality that has happened by our great man here. But why I'm telling as a leader, image is important. That image is created not just by talking in a stage, but also in the online platform. He followed a perfect e-professionalism, and that is what I am telling. It is a great thing to achieve, and it would not have possible unless until he was digitally strong. So his presence in the digital field is very, very strong and very influential. It is. He puts a very strong statement, and he browse the internet very huge, where other people may not do that. Well, initially, Digital India started in long back in 2015 July, but then a lot of changes that happened. You can say that city became a digital city. There are some selected cities they converted into digital city. They say, I am the future, I am the digital citizen. Then even the banking sector also become a digital one, and everybody started using mobile app, and that has helped a strong platform for our tackling the COVID-19 disease. Now, if this digitalization has not happened, we would have suffered drastically during the COVID-19, but that didn't happen. We came up very strongly, come up with as Sir said, a lot of the aspect of India is recognized globally. But then what we can do in this e-professionalism, think you can't share everything in the platform where you're using and disclosing your profession, but you always have to think what we can do. This is important. First, you have to ask, otherwise I can say who we are. That means who you are or who I am. We have to think. So then this is for not just for the pharmacy profession. It can be for any profession in this world, any shopkeeper for that matter. Who we are going to be in future. So this very, very clear definition. You have to define what we are, and how do professional bodies impact on us. For example, ACT or PC, how do they impact on us, or government bodies, so that is what we have to understand. First we have to question, then you jump into e-professionalism. What can we do to create and maintain effective online presence? So this question, if you answer, automatically you have the e-professionalism in front of you. That means you will be very popular. That is the meaning of it. But then you can't do anything and everything in the e-professionalism. Universities have brought out some guidelines, not in India but abroad. There are guidelines for e-professionalism. You can't share everything and anything in the website. So you have to bifurcate from your professional to your personal life. So personally, you might have a professional or like Facebook, but you as a profession, you should follow certain honesty, integrity, reliability, responsibility, and respect. Now, I'm not defining all this term. So most of the term you know about it. What is honesty? So honesty was fundamental that is practiced in India. Okay, they never thought of this ethics. So ethical business came from the foreigners. For example, when you are practicing a medicine in India, they were very honest. They are following, they are believing in the God and practicing the profession. Whereas it was implemented, ethics guidelines are implemented by the other countries when they invaded India. Of course, the integrity, reliability, responsibility, all these terminologies are important to say ethics guideline, or we generally call it as all ethical guideline. Some of the very important aspect is honesty. When you say how honest I am, for putting my data, putting the information on my e-platform. So honesty in the sense what you put, and it should be there in the heart. So what I display here, it is not like displaying, your when we book a hostel or a hotel, they put a lot of beautiful picture, but when you go there, bed will not be similar, bed will not be as it was disclosed in the website, or bathroom is having a lot of problem. So there is no honesty in that business. Or if you say integrity, what I do is I'm practicing. So when I say something online, I should also have practiced. So that means when I say this picture, I have a reflection there. When you come that place, it is there in my place. That is what integrity means. At the same time, we have to have respect for each other, respect for the profession, respect for the people, respect for the teacher, respect for all and every object in this world. So that is what is important in professionalism or e-professionalism, and it is not simply you should have that. Now that is what we everything we consider as honesty, but it can be different. Then the professional ethics come, because nursing people have to do this one, pharmacy people have to do this one, and they have certain guideline. Medical surgeon has to have this one. So there is a some guideline. So those are all become ethical, professional ethics. There are some oath, all that has come. But in reality, it is the honesty and integrity and how responsible I am to putting this information. So if somebody asks, am I be answerable? So those are the things we have to consider in e-professionalism. Now I'll be talking just a few slides. This is just opportunities for the community pharmacist, in the future. Or we never thought of drugs can be delivered to the home, but it has happened, and also online medicine, everything it is practiced. So now this is one area where we can think a lot using a platform, or we can have a development of a organization or a business entity for medicine delivery to the home. But then as a community pharmacist, I'm a dispensing drug, but then I can keep this platform. During the COVID lockdown, there was a lot of difficulty. Most of the, say, my place, they gave a message, okay, we deliver the medicine to your home. So you don't have to come here. You just send the prescription. We'll deliver the medicine. So that's the professionalism that they have. They have used the SMS as a platform. That's a greatness. So they deliver. So that is e-professionalism. Now what they say, they do that. They deliver it by half an hour. So that's the greatness about the profession. Well, there are a lot of other opportunity. Drug information is a great area where you don't have to do anything, but you can link to the different website in our platform. Or if it is very important, where you can explain, you are the expert in that, you can read and explain and keep that as a small, website display for the people. And I'm sure that all people are doing that, but simply it is not said as a e-professionalism, but it is practiced. So I know the people who are here who are doing. In fact, Sunil is having a lot of experience in this e-professionalism. In fact, he's practicing that. He's very, very alert online, and he has conducted a lot of these webinars when the lockdown has happened. And that is what the e-professionalism is. Now, coming to the other diseases also we can have, because diabetes is huge in India. So we can have like this kind of practice we can do. Though we are practicing as a community pharmacist, dispensing, we still have a lot of sufficient time. We can just spend half an hour online to make this kind of change, because technology is huge now. Everyone they do the services free. So there are people who do that, and there are websites where we can freely display a lot of information. They're called open sources. Well, similarly, the cancer is another area where we can put information, because people are searching for the information, or about tobacco smoking or tobacco related issues can also be displayed as a e-professionalism. Well, this is everlasting area where we can serve the people being on online platform during the pregnancy, so related information, but you should be honest enough and you should have integrity. Whatever you're telling is right and correct and validated. So that's very important. You can't just put everything in the website. Now there is no people to validate your, but only the people have to assess that whatever you put. And if the people likes you, you can do your actual business. For example, when you organize this kind of webinars, you will come to know better about Mahe, Manipal or MCOPS. So I am publicizing by this mode where I am delivering my talk, or at the top I am just displaying my university logo. That means you are familiar with Manipal logo now. So that is how I am just a platform I am using as a webinar. But ultimate ambition is to improve our image as well as our business, if you are really doing the business, but honest business. Of course, we can also think of old age care or a lot of other aspects, a lot of other opportunity. Vaccine is a very, very important, and now it is very essential to give the information. It is not I am telling you deliver the vaccine, but it is just information you can have online platform. What people have to do for vaccine, how do they tackle the vaccine, which vaccine they have to take, where the vaccine is available, all this. Or for that matter, if this COVID is gone, it's cured or something, there is still we need vaccine. So vaccine information is essential. So that is where it's playing very important. From the birth to the death, there are several different vaccines. So I'm just putting one, or we can also have a lot of avenues that comes. For example, government has a lot of programs, leprosy program, HIV program, TB program. For TB, they want to get rid of by 2025, and that has been implemented in Karnataka state. Don't know, even US people also, scared of, they don't know, not sure. But India has made it its point that we are getting rid of TB, tuberculosis, one of the highly mutated organism. So vaccine and many other government programs can be displayed, information can be given as a professional. Now at Manipal, for researcher, now I am a researcher, and for a research I have contributed. I said I have a center, and in the center activity we have implemented a portal called as Pure Portal. This is what Manipal Research Forum Pure Portal, which is implemented. It is a fingertip. You can just click here on this is a Pure website here. When you click on this, you will see each department, institution, and one point click. So you can just click here, you will get about MCOPS. You can just click here and put the name Yogendra Nayak. You will get to know about different aspect. You can see his profile or her profile or scientist profile by linking it to his research, scholarly research output in Scopus, Web of Sciences, WebMed, PubMed, all that. And also you can also see their social media, that is pseudo scientific social media like Mendeley, ResearchGate, Publon, Academia, and all that can be linked, as well as purely social media like Facebook, LinkedIn, Vidwan, YouTube, Figshare or Twitter can also be linked here. It's a beautiful portal which we implemented. And the social visibility forum is very important to have collaborative research in future. So it increases our visibility, researcher visibility, as well as it increases the collaborative potential of a researcher at Manipal. So this is what we implemented, and it is going on, and it is very expensive. Rather, I am the admin for this portal. I have implemented by in 2017 December we launched this portal, and it's only one portal, unique one. None of the other institution in India has. It's only Manipal has, and Elsevier has given exclusively to Manipal. They have not given to other institution because they analyze the institution and then they give it. Well, having said that, you can see the network of collaboration of Mahe Manipal. Now, I'm not just advertising what we have done in the social in the website, in the platform, in the website platform. This is what you can see. We have more than 2,125 collaborating institutions for last 5 years. This is only for last 5 year collaboration, and many co-authors. This is from the institutions all over India. We collaborate around 360 institutions inside India. We collaborate. Plus, if you see the Asia Pacific, this is a collaboration what we have, and all that is possible using the pure portal or research visibility forum. Now we are implementing one more thing here. Even we can also regulate the grant portal along award management. Everything can be managed in this portal. So this portal is very our social media, or what we can say is e-professional platform I can consider, or it is the visibility forum for Mahir Manipal, which is done. That's the reason I have put Center for Research on Research here, because I'm in MCOPS, so I have put here my college AMBLS logo as well as Manipal logo here. Having said that, let us have this neat, what is called as ambitious e-professional in the future. So let us meet on the day of World Pharmacist Day on 25th September. I wish all of you a happy World Pharmacist Day, which is coming ahead in year 25th of September. So with that, I finished my talk, and if any questions, I am ready to answer your question. Otherwise, I thank at this moment. This is my mobile. You can WhatsApp me, or you can communicate to me, or you can do by email also. You can communicate to me. With that,
Awesome, sir. Fantastic.
thank you. Yes.
As they say, as you think, so you become. This was one of the most illuminating, you can say, the kind of lecture that you have given, or we have got on Webinar Jam, particularly of the great strides that Manipal is doing. It has always been a lodestar institution which has created a model for other organizations to follow also. And Dr. Nayak, sir, you have done a very good job of showcasing it. And I just love what you do, research on research. Amazing.
Yeah,
So,
it is research on 1 second, sir. Research on research is an area which is coming up, which mostly India has not implemented. It is a very futuristic one area, because after our implementation of research on research in India, in the first time in India, in Manipal, Welcome Trust has made a center. They have opened a center called RORI, Research on Research Institution in UK. Research on Research Institution in UK. We had communicated when they launched that center that we would like to collaborate, but by then a lot of changes happened. COVID came, and that network is not working now. Otherwise, it has a lot of meaning and a lot of importance in research on research. It's not just analytics of research, but a lot of meaning is there.
okay, sir.
I wrote a book chapter also. If it is necessary, I'll share it later.
Yeah. I need that. Okay. So now, actually, KRPA, Group Pharma, these are all very collaborative institutions. So I am not going to pose any question to you. I am only going to suggest to you, please bear in your mind about Group Pharma as well as KRPA. So in the future, research on research should involve us also. That is what I am trying to say, that you please make us a part of your journey. So you have got a lot of encomiums. You means Manipal, your work, everything. Now I would like to go to Dr. Madhavan, sir. So please excuse me, Dr. Nayak, sir. And Dr. Madhavan, sir.
Yes.
That last but one slide, you have to give it as a giveaway. It was awesome. Summary of your entire talk.
Thank you.
Congratulations.
Thank you.
I have only one question to ask.
Yes.
Because there are again appreciation on appreciation. See, the Manipal quality is such that you are all benchmarks. So obviously people are going to shower appreciation on you, and that puts more pressure on you to perform to a greater level. So now I want to know what pharmacotherapy approaches we can have. Currently, we are all focusing on ACE2 receptor and that spike protein. Do you see any other target molecule in the CNS? Because you have done so much work.
Yeah, in this for CNS, because there are a lot of roadblocks to come into because that's why initially CNS was spared as far as the SARS-CoV-2 infection was considered. In the sense, nobody looked into the CNS problems. But later on only these things started. Now its management is based upon the drugs which are already available. For example, in case of GBS, it is the IV immunoglobulin, that is a treatment therapy for that. So seizures also managed by normal anti-epileptic drugs. So there are no such treatments which are directed against the SARS-CoV-2 in CNS because of several hurdles or roadblocks that are connected with that. So maybe in future, people can think about some of the drugs which can cross the blood-brain barrier and can attack the SARS-CoV-2, which is concentrated on CNS. So now, as such, the therapy is directed towards the pulmonary system and the periphery.
Marketeers are always freaks, sir. So I am one of that species. So I'm already imagining Dr. Madhavan sir will give us snuff powder, which you just sniff, and through the olfactory bulb, the powder molecules will go in and kill the SARS-CoV-2 virus.
Yeah, sure. Thank you, sir. That is one of the route, yeah, they're really looking at because of the olfactory route, which is having entry into the without crossing the blood-brain barrier. Yeah, true.
That's
Thank
what
you.
marketeers do. They may simplify everything. You tell it in such a very good language. We try to think, okay, it's just a snuff and we will snuff out the virus. Thank you so much,
Thank you.
Dr.
Thank you,
Madhavan,
sir.
sir. And now the platform. Dr. Nayak, sir, I take your, what do you say, leave. Thank you so much. Dr.
Thank you, sir.
Madhavan, sir, also thank you. And
Thank
now
you. Thank
over
you.
to Dr. Kaushik.
Nayak sir, I have a few questions to you. I think you started many things on taking that initiative, and you started so many things. What is the first thing that you think of, or what is maybe I'm seeing in the other part. Do you fear to start something new, or what is that courage that takes us to start new things that you're been doing that? Or is that the institution that pushes you or gives that freedom? And what just few words on that, sir? Yeah.
Let me make my perception of how I studied. It is my habit of studying something new, which I go on study. If I read, it is difficult for me to understand if I read once, but then again I'll read. So when I read more and more, I'll understand better and better. So still I make a conclusion out of it. I read, even if I sit in the night till morning. Also I read, and then I conclude, and I'll come out with some new thing out of what I read. So that is how it has happened. So this is what is something new area which I found, something which is not really it is practiced, or it is not thought of by other people at our place at Manipal. So I thought, let me venture into it, and I studied. I became a specialist. In fact, this area is mostly tackled by library sciences or a statistician or somebody else. So, but then I thought, this is the area which a researcher has to tell. A researcher, and they will realize, the other researcher will realize, rather than a library sciences people will be coming and explaining, or another company people are coming and explaining. So then it started all. One second. So that is how it went on, and I became a new venturing into a new area. That's I don't have any other answer for that. I think maybe I think I have answered your question. I feel.
Yes. Good, sir. Nice to have you. That you bring so much of motivation. You bring out so much of energy that if at all any of the young students that are watching, to start, they have also planned to start something. They also can take a note on what you said.
Yeah,
So nice,
one thing I want to add here is the research orientation that I started in MCOPS. I used to do it with a small number of people, and then because it was my guru who suggested, Dr. M.K. Unnikrishnan, who suggested me, why don't you continue? Because he used to do a lot of orientation to the PhD, PG students. So it continued with the legacy, continued with the student. As a his PhD student, I continued that year. And during that orientation, I realized that this kind of certificate course is essential. And Mahe was encouraging the certificate course. I applied through the route, and then registrar kept a meeting, and that was approved. But that was a very new of that kind. People are asking, you are a pharmacologist, what you are teaching is entirely different. But similarly, it went on. I think it was 8 batches I have completed. Now another batch is going on in November. I'll be starting another batch. There are I keep generally 30 participants for the certificate course. This time it is all full, and then somebody requested again. I have to reopen that. So I can't manage more than, because I have to assess them, because whether they know, they understood, I have to give them assignment and evaluate that, and then I come out with the certificate, their marks, everything. So that is a difficult task. So that's the reason we limited 30 participants. But still I can open it to 50, they say, because it's online. Earlier it was offline. Online delivery, but it is not an online course as such. I wanted to make it as an online course in future. Maybe next year I am planning for online course where many people can participate. Well, that is about the certificate course. As you said earlier, I mentioned also, I have a advertise or post. That also I can share it.
You said, what is the one message that you that I went to my mind was that the legacy of the teacher that he passed on to you. I think the teacher's day is coming tomorrow. I think what a message to all of the people who are hearing that. Very much happy to hear that, sir. And sir, Madhavan sir, thank you very much for sharing your dissemination of knowledge. Is something that we always KRPA that do that. I think Sunil sir also made a point that if at all, if anything related to collaboration or any activities that you could think of doing that, please do think of us.
Yes.
And we're also doing a couple of activities with Manipal. I think maybe next month we'll be reliving that. And also congratulations to the whole team of Manipal, because now also heard that you had a MOU with Anthem Bioscience for that also. I think congratulations on that. Once again, thank you one and all for being here. Thank you Madhavan sir, and thank you Nayak sir for taking your time and spending on a very pleasantly explaining all the things. And once again, I must say thanks to Sunil Chuplinkar sir for managing everything. He's our go-to man. I think sailing the ship as a captain. Thank you very much, Sunil Chuplinkar sir. And to all
just a moment, please. As a president, kindly express thanks to Dr. Nandakumar sir. He is not able to join. Okay. So please.
Yeah, thanks to Nandakumar sir. I think we had received a mail. I think how does the Manipal plans? We had received a mail 1 month back. This is how the meticulous planning happens. I think that is where I think as John K. Kennedy, I think who was the president of US, once said American roads are nice not because America is rich. America is rich because American roads are good. That's the infrastructure of Manipal that is there. Once again, very happy to have a webinar with Manipal, and thanks for joining each and everyone. Thank you once again. Over to Sunil sir.
Excellent. Thank you very much. I take the permission from all the presenters and attendees to close the webinar. May I?
Thank you, sir.
Yes, sure, sir. Thank you.